Good afternoon, everybody, and welcome to Navigating Employee and HR Questions During COVID-19, hosted by BBB Serving Connecticut. This is a part of our COVID-19 webinar series. We're going to be covering a lot of topics today about HR, any employee-employer questions. My name is Luke Fry. I am not Jackie McKnight, although my account says that. And I'm going to be moderating today. I also have a great staff member, Joni Green, who's going to be helping out with some Q&A later in our broadcast. Just a reminder, everybody is in mute. So if you have any questions, please feel free to type them in your questions box. And we're going to try to cover as many questions as possible during our Q&A. Unfortunately, if you have called into our broadcast today, you are not going to be able to ask any of your questions at this time. However, if we don't cover your question or you have a dire question still, you can always email me at lfry@ct.bbb.org. Also, if you are logged in by your computer, you can see that we do have a handout. We have the PowerPoint slide deck available to download. We've included a lot of great links to resources. So if you would like to download the PowerPoint, that is available over in your handouts tab. Prior to opening up with Mark, we kind of chatted about a few great FAQ documents available online now that he is actually going to be covering some. And we have those sites up on your screen right now. If you have called in, they are the Connecticut Department of Labor at ctdol.state.ct.us. They have a great FAQ PDF you can download. They update it frequently. There's also some great resources at irs.gov and dol.gov as well. And then also, Mark Soycher is from CBIA. So CBIA has a great site and some great resources as well. So you can always go to cbia.com, and you can also go to bbb.org/small-business. And we also have a lot of great consumer and employer articles on there as well. All right, and today, like I said, we are going to be speaking with Mark Soycher. He is the Human Resource Counsel from CBIA. Thank you, Mark, for taking time out of your day to join all of us who have questions about how to sort of navigate their HR and employment questions right now. So I'm going to kind of kick it off, and let's first kind of clear up the difference between furloughing employees, laying off employees, and if you aren't able to keep everybody employed, how do you choose between these two?
Okay, thanks for having me, Luke. Looking forward to hopefully providing some good information to people. It's literally been like drinking from a fire hose over the last 3 weeks or so in trying to both absorb all of the information that's coming out from various sources, try to put it into context and apply it to myriad practical circumstances that companies are dealing with, and fielding just literally hundreds of emails and phone calls over a short period of time. This was one of the initial questions that came up, and interestingly, I really hadn't thought that much over the last few years about the difference between furlough and layoff. Furlough is really not necessarily a legal term with any significance to unemployment for purposes of eligibility, but has more been an employee relations term that's been used over the years. And in digging through some older references to that to try to get a handle on how best to characterize it and apply it, I think that the easiest way to look at it is a furlough is a characterization of a temporary separation with an employee or a cessation of work for that employee. It's not intended to say goodbye, we'll see you, have a nice life, it's been nice, but rather because of circumstances, whether a business downturn, which it's been used in the past, or an interruption in business because of a weather event or a health issue like we're faced with today, we don't have work for you for the time being. And oftentimes in characterizing this temporary lack of work characterized as a furlough, a company might offer to preserve someone's seniority for when they return to work, if seniority is an issue in their status, preserve their PTO level of accrual so that when they come back to work, they will still have that paid time off available to them because it's not really an intended long-term or permanent separation. And then possibly also the third element that's often included in the arrangement for a furlough is some type of continuing assistance with group health coverage during the interim period. Now, as far as the second item there, the PTO time, to preserve that, state law has a provision that says when an employee separates, the employer is obligated, in accordance with their policy or consistent past practice, to pay out all earned but unused PTO. I have not been able to get a clear indication from the Connecticut Labor Department whether they would step in and enforce a payout of accrued but unused PTO in a furlough situation. I would hope they would respect the option of having the employer retain that for use when the employee returns, or if the furlough turns into a permanent separation, then it would get paid out. But not completely sure what their position would be on that. I've been advising employers generally to try to preserve the time if they can, because the employee will be getting unemployment during this interim period. And if they're going to use PTO time, if it's going to be paid out, then they're not going to be eligible for unemployment. With respect to the continuation of group health coverage, employers have, rather than switching over to COBRA, if they can avoid going through that process, because this is hoped to be only a temporary situation, I think the insurance carriers have indicated that in general, they will allow employers to continue to carry individuals on a furlough status for some period of time, as though they were still actively employed and thereby eligible as an active employee. I suggest checking with your carrier to determine whether or not that's an available category for continuing coverage. And I know under the CDIA group insurance plans that we offer, our carriers have indicated that they will accept the employer's decision to continue to carry that person as an active employee. Now, during that time, the employer can either charge the person what they were charging while they were still employed, or in some cases, employers have been picking up the full premium for workers during that furlough period. That's really a discretionary matter on the part of the employer. The term layoff, in contrast, is separation. We don't have any work for you, and we don't know if or when we would ever have you return to work, but for now you're separated and we're parting ways. In both cases, if there's a lack of work and the employee is not otherwise eligible for income from another source, they would be eligible for unemployment benefits. So I'll shut up for the moment there because I could roll on with more stuff with that. But
no, that's great. Thank you.
We do have a sample, and I know you have the CDIA website there, cdia.com. Within CDIA's website, we have been, I characterize it as the attic where you shove a lot of stuff that's good you want to hang on to and hopefully access at some point. We've been pushing into our website and out to companies as much information as we can gather. And within the coronavirus section there is a link to some additional resources, which includes a sample furlough letter an employer could download and use if they're going to be furloughing employees, because it is important to characterize it for employees so that there's good communication on that.
All right. And then we also had a question. So for those who don't know, what is the shared work program and how can that help an employer actually save money?
Yeah, the shared work program is a program that's been around for many years, And its intent was, as it's historically been used, when a company is faced with what is expected to be a temporary downturn in business, not requiring laying off a lot of people, but laying off some people possibly. And what often happens then when the company does that and expects work to pick up again in the future, those folks who are laid off may collect unemployment for a period of time, but oftentimes go off and find a job somewhere else. And the employer then loses that institutional knowledge and skill. So under the shared work program, rather than laying off a number of people completely and parting ways and risking never having them come back again, it's to share the work that's available among a larger population of workers and reduce the work hours and income for a larger group of employees to a lesser degree than total unemployment. Normally, outside of the shared work program, if a worker has a reduction in work hours during a week, it is possible for them to apply for partial unemployment benefits. But without the shared work program, when someone would be partially unemployed, the unemployment system would determine what amount of benefits they would get if they were totally unemployed, which is about half pay up to a maximum, and then reduce that total unemployment benefit rate by the 2/3 of what they actually received in wages that week. So the simplest arithmetic example of that is if someone's reduced to a 3-day work week, their 2.5-day or about half-time amount of unemployment benefits would be reduced by 2/3 of the 3 days wages they got, which would leave them with about a half a day of unemployment benefits, replacing the lost 2 days of income. So they'd end up with about 3.5 days of income in that partial unemployment situation. Under the shared work program, they apply the 50% unemployment benefit rate to the reduction in hours and earnings. So the employee in that 3-day work week would end up with about a day's pay of shared work unemployment benefits to supplement their 3 days of wages. So they'd end up with about 4 days of pay in a week when they're only working 3 days. And companies have to apply to the Labor Department for approval with that. The application process may take a little bit of time, an hour or two, to pull the basic information together and then submit the workers they would like to have participate in the shared work benefit program. And I advise companies to submit as many employees as they think might be have their hours reduced. And it's incredibly flexible. Once approved, the company can then reduce hours for whichever workers they need to. And so they can shift from department to department among different employees from week to week. And then rather than the employee submitting for unemployment benefits, the company submits to the Labor Department a list of employees whose hours have been reduced. And the unemployment office will then issue unemployment checks as shared work benefit payments to those who've had their hours reduced. The company is not restricted from laying people off at the same time if they have to. The only restrictions are they have to have at least 2 people participating in shared work benefits, and they have to maintain other benefits like medical insurance at the full employment rate. So there's a bit of an additional cost to an employer rather than laying someone off. But it's a way to hang on to people and supplement their partial earnings for the week with a more generous calculation of unemployment benefits, thereby hopefully having them remain connected to that employer. Employers I've spoken with, once the initial paperwork is submitted and if they've gotten approval, it's for a 6-month period of time, and it can be renewed for an additional 6 months. But the administrative task from week to week, generally, it's been reported to me, is rather minimal to submit to the Labor Department for that. And it's completely up to the company to submit people one week, none another week, a larger group and another week. Within the company's control, if they have a full week of work for a company, for an employee, they can advise that employee they're working a full week. And if the employee says, no, I kind of like the shared work arrangement better, the company could say, well, we're not going to submit you for shared work because you're declining an offer of full-time employment. The employee does have to remain available for the full work schedule if need be. So it is a very flexible program that companies are using, and hopefully if a company still has the ability to continue operations, it can be an attractive alternative to laying people off completely.
The Connecticut DOL actually has a whole site dedicated to it. So if you have any other questions, you can always go to sharedworkct.com, and they actually have a great intro video there to kind of explain what Mark kind of did, but also offer other details as well. Let's now get into
put together a short little cartoon video that is a good overview. One other point, traditionally in the shared work program, as part of the application, an employer has to check off a box attesting to having made their application for shared work available to workers for a 7-day period, and solicited any worker comments about doing so. Because of the and that would be a preliminary period before they could get approval for this. I believe the Labor Department is waiving that 7-day period again, and it also requires an attestation that the employer has provided notice and posted a notice in the workplace. Because in some cases, a lot of people are not coming to work, they're working remotely and may have reduced hours, but from a remote work location, the questions come up, how do we notify people that we're applying for shared work? On the shared work website, there are a couple of links to FAQs for employers and FAQs for employees. The FAQ for employees is I think it's a nice 1 or 2 pager that's informative, gives the basics. I think that sending those remote workers a link to that informational piece should suffice to satisfy the employer's responsibility to give notice to employees that they're participating or applying for the shared work benefits. So a little bit of a strategy for coping with the remote work arrangements that we've all gotten. Nobody's going into the kitchen to look at the bulletin board to see the latest notice that's been posted.
Yeah. All right, now let's get into the FMLA and Families First Coronavirus Response Act. So how do employers deal with employees who have to take off time for sick family or children, and or an employee who doesn't feel that it's safe for them to be at work?
Okay, got a lot of different pieces in there to drill down to. The Families First Coronavirus Response Act was an amazingly rapid enactment by Congress to expand the family and medical leave law and paid sick leave provisions. Normally, passing legislation like that would take several months with hearings and a lot of lobbying activity, fine-tuning, things like that. They sped this provision through on an emergency basis, and it's almost like launching a ship and not being sure if you've closed up the hull and put the engine in there and stuff with provisions and explain to everyone how to operate that ship. But it's kind of like, well, we'll figure it out as we go along. Over the course of the last few weeks, once the law was enacted by Congress, then a tremendous number of questions popped up. What does it mean? Who's eligible? What are the provisions here? And over the course of those weeks, the Labor Department and the IRS have issued growing lists of questions and answers. And I say growing lists because initially they had some Q&As that were, I think there were about 30 of them, and now they're up to about 80. both on the Labor Department and the IRS. But they've done a very good job in pushing out some questions that are many of the typical questions that companies would have and workers would have, and offered explanations for a lot of this, and in some cases caused me to change course in the advice I was giving to companies, because initially we were speculating about how to interpret a lot of this and apply it. But essentially, the law created an extension or expansion of the traditional FMLA that those businesses with 50 or more employees have come to know and love, but to expand it to apply to companies under 50. It applies up to 500 employees or 500 and below, and then even to those companies with fewer than 50 employees. Before I get into the details of that, there is an option to be exempt from the paid leave provisions for companies with under 50 employees as a small business exemption. And initially, it was thought that this was going to be something you would apply for, get certified, and you wouldn't have to worry about it at all. But through clarification, now it's an exception from the law. If a company would like to take advantage of that, they would have to show that compliance with the law would jeopardize the business's viability in some way, and it only applies to the obligation to offer the paid leave in order to remain home when caring for a minor child whose school or daycare has closed. It is not an exception or exemption from having to provide paid leave for the first 2 weeks of the paid leave provisions. That's characterized as the emergency paid sick leave provisions of the Families First Coronavirus Response Act. The law provides for paid leave, as I've alluded to, so as to the small business exemption, it's not as broad an exemption as some people have thought. It's not something you apply for and get certified. It's more on a case-by-case basis, and there is information within the Labor Department's Q&As for the type of documentation and analysis that a smaller business should examine and consider. Create some notes about their determination that this would jeopardize their business's viability, or it's a key person they can't do without, and then tuck those notes aside for use later. Advise the individual who's seeking the leave that they cannot provide the paid leave to that person, and then hope that the person accepts it. If they challenge it, it might end up in a dispute before the Labor Department, and at that point, the employer would take out their documentation to try to defend their decision that they're unable to provide it, because doing so would jeopardize the business's viability. So it's not the easy, oh, we're small, we don't have to comply with this provision. So it does warrant some close scrutiny. The law overall.
So yeah, I actually. Yeah, sorry, Mark. I actually had a question emailed to me about that, and I believe you just covered it. However, someone emailed me asking, what happens if you are an employer who has adopted the new FMLA rules but isn't legally required to? We only have about 30 employees. In the best interest of their employees' health, they are offering the FMLA 2-week sick time. However, they have an employee that wants the 10-week FMLA sick time, I guess. So will they be eligible to receive anything even though they aren't legally required to do so? Is the question.
Two possible aspects to that question, and I can't determine precisely the fact situation there, but number one, for a smaller business that could be exempt from the law if they sought to, they don't have to. The default is that everyone is subject to the law, including those under 50. The opportunity is there for an under 50 employee company to be exempt from providing paid leave for purposes of the expanded FMLA, which covers the child care responsibility, not the paid sick leave. And so a smaller company that would choose to accept the responsibilities to provide various aspects of that law with both job protected leave time and paid leave time is simply complying with the law, not seeking the opportunity to be exempt from it. And if they do simply comply with the law and pay the benefits, they should be sure, as I'll touch on in a moment, to document the circumstances for which the person is seeking paid time off from work, to make sure that it does fit within the covered situations. And then equally as important, to properly document the circumstances of the leave so that they'll have adequate documentation that the IRS might look for when they seek to recover the costs of that leave through the payroll tax credit that's available to employers. Now, the two circumstances that I've referred to as qualifying for leave under that law, one relates to health issues and the other relates to child care responsibilities. When an employee, him or herself, is either experiencing symptoms of COVID-19 and has sought medical input, diagnosis, guidance, or has actually gone for a test, that would be one of the circumstances where a person would be entitled to remain away from work and be eligible for emergency paid sick leave under that law. Another circumstance, and they would be entitled to up to 2 weeks, and it's phrased as 2 weeks, 10 days, or 80 hours. And it depends on the schedule of the person and the timing, but the 80 hours is one cap to think of, and to illustrate that, if a worker normally was scheduled to work overtime in a week, the overtime hours do count. So, for example, the first week, if they worked 55 hours and were paid 55 hours of emergency paid sick leave, and the second week, if they put in another 55-hour work week, they wouldn't get another 55 hours of emergency paid sick leave. They would only get 35 hours. No, whatever the math is, I'm talking and thinking at the same time here, but only a total of 80 hours. Yeah, if an employer chose to pay them for all of the time out, so, including the overtime hours for both weeks, they could not recover through the payroll tax credit the total hours for both of those weeks. They could only recover a total of 80 hours. So that's why it variously is phrased as 2 weeks, 10 days, or 80 hours, depending on the schedule the person is on. Now, someone who can't come to work because of health concerns related to themselves, they're diagnosed, they're self-monitoring because of a doctor's guidance that they should do so, or subject to a quarantine because they've traveled somewhere and public officials have said, if you've been to this location, you have to remain home and self-monitor. They would be entitled to 100% wage replacement for those 10 days, 2 weeks, or 80 hours. The other health-related absence that's covered under that law is if the person can't come to work because they have a family member they're caring for who has been diagnosed or has been advised to remain home. And the medical advice is that this person is needed to provide care for that person at home, or the individual's own doctor has said, because of your exposure, you should remain at home. But if it's a family member's health that's requiring the person to remain at home, they'd be eligible for the same amount of time, the 2 weeks, 10 days, or 80 hours, but it would be at 2/3 pay for those first 2 weeks. Now, the additional time that a person might also have to remain home in that initial 2-week period would be if they have a minor child whose school or daycare has closed because of COVID-19, and they need to remain home to care for that child. Interestingly, the question arose early on: what kind of documentation should an employer have? And we've posted information on CBIA.com, and it's extracted from the Labor Department's website and the IRS website, and it indicates that the person should have a notation, who they are, the time they need to be away, and some reference from a healthcare provider if it's related to a health concern. Initially, the thought was they need to have a doctor's note. However, because both the CDC and others have suggested let's not have doctors spending time writing notes. They need to be spending time providing care to people. So the clarification has been that either a written or oral report of medical care, medical guidance to remain home should suffice. So an employer should be asking, who's the doctor? Give me the contact information. So if we choose to, we can verify that. So an employee should be asked to provide that in order to be eligible for that paid leave. In the case of the school closing, it's almost universal that schools are shut down and all of that. So I think simply a notation of the name of the school or the name of the child care facility, possibly a screenshot from the website to show that it's been closed, just as backup documentation, again, to substantiate the individual's eligibility, but also as documentation for the IRS to back up their seeking to retain payroll taxes to get a credit for the costs of that paid leave. So that covers the first 2 weeks. The remaining 10 weeks that you referred to is part of the expanded FMLA paid leave and is only available when someone can't come to work for those child care responsibilities I've been speaking about. It is not available for additional paid sick leave. And so some confusion arose at first because the expanded FMLA paid leave said you get 12 weeks of expanded FMLA, but you only get 10 weeks of paid time. The first 2 are unpaid, but the first 2 then are covered under the emergency paid sick leave provisions. So the 2 kind of pair together, and there are some interesting scenarios that can arise where someone might end up with a period of up to 14 weeks if they initially took time off for their own health issues for 2 weeks and then subsequently sought time off for child care responsibilities. The 2 weeks would be the emergency paid sick leave, and then it could be an additional 12 weeks, the first 2 of which would not be paid for child care responsibilities. But the person could get unemployment for those 2 weeks, and then the subsequent 10 weeks would be paid again at 2/3 pay for that leave period. So a lot to digest with that law, and we've been struggling with various scenarios with that. The cost of the leave that's provided are recoverable, as I suggested, under the payroll tax provisions. And what would happen is an employer should be documenting on their payroll the paid leave that they're providing to the absent worker should be noted as a separate payroll item on their payroll records, so that subsequently when they're issuing payroll to the larger population of workers who are still working, they would send the net pay to the worker for wages, and then the payroll taxes they would ordinarily remit to the IRS. They would hang on to that as recovery of the costs of the paid leave. The IRS provisions also have explanatory information how to calculate the portion of group health insurance costs to the period of leave for the absent worker because they are required to maintain that leave. And those allocated costs to that period of paid leave are included as recoverable costs through the payroll tax credit. So, kind of a total recovery of costs. It doesn't help out with the interruption of production, but it certainly does cover the costs of the payroll for that period of time.
And are there any other questions that have been popular that people in CBIA or other business owners have been asking you that you'd like to cover prior to heading to our Q&A?
A lot of administrative stuff and questions come up with respect to employees' PTO time. Can they use that? Employees can't collect company PTO time and paid sick leave time simultaneous. They can't get unemployment benefits at the same time. One question that has come up quite a bit, and it's a tough one, that the emergency paid sick leave and the expanded family leave are targeted towards those specific documented circumstances that the individual has had consultation with and guidance from a healthcare provider to remain away from work, and or childcare responsibilities. In cases where an individual is just not comfortable coming to work, they've heard the governor's pronouncements about everyone who should remain at home, and yet their employer is saying we're one of those myriad essential businesses that are permitted to remain open. We've arranged for remote work as much as possible, but there are certain tasks that need to be performed on site, so we have work available. And yet at the same time, there are some workers who understandably are saying, I'm not going there, I'm staying home, just out of anxiety. Completely understandable that a worker would make a decision like that. However, an employer should not issue emergency paid sick leave to that person, expecting to be able to recover that through an IRS tax credit, simply because without that medical documentation, they're not going to be able to substantiate that, and if challenged, they'll be lacking the documentation. As far as unemployment being a backup for replacing that individual's income while they're remaining at home, on the unemployment website that you've got there, and interestingly, the snapshot you've got of the Connecticut unemployment notice, I forget which date it has, but they've been updating that regularly as well, and that's been updated as recently as yesterday. So the latest date on State Labor Department's website is April 7th. But they did indicate that they've got a Q&A tucked within their information about an employee who says, my employer's called me to come back to work and I'm not comfortable returning to work. Can I get unemployment benefits? And the answer that they've got there is only if the worker can, if work is available, the worker would have to cite either some medical basis for not being at work, such as specific doctor's guidance for that employee to remain away from work, in which case they probably would then be eligible for the emergency paid sick leave. And if they remained out beyond the 2 weeks, 10 days, or 80 hours time, and still under the doctor's advice, they would then be able to get unemployment benefits. Or if the employee could say, the reason I don't want to go to work is because it's a dangerous environment. For example, they're making me work shoulder to shoulder with any number of other people. They're not issuing masks. They don't have any Purell around. There's no social or physical distancing being practiced, and everybody's touching everything. That, and I'm overplaying that a little bit, but that would constitute an unsafe work environment in the employee's eyes and probably in the viewpoint of the unemployment office, and they would then award benefits to that person because their employer is not providing them with a safe work environment. If, on the other hand, as many employers I've spoken to, have restructured their workspace so that people are distant from each other, at least 6 feet. They're providing some type of face covering, whether it's fabric or actual face masks. They've got containers of sanitary wipes that people are, and instructions on how to regularly wipe down touch surfaces and cleanse the workplace on a regular basis. The latest governor's information that came out late yesterday speaks about having employees consume meals alone or in their car, possibly, so they're not gathering in a collective lunch space. Doing some imaginative shift scheduling and various other steps to allow people to continue to work, but to maintain those physical distances. If an employer has done all of those things, and it is purely a worker's anxiety that's preventing them from coming to work, they'd possibly be denied unemployment benefits in that situation. So it's a tough call for an employer, but that is the direction that is possibly the determination that would possibly be made for eligibility for unemployment benefits.
That was a great question. I'm glad you covered that. I'm going to turn it over to Joni. I get that some people are having audio issues due to the mass amount of people currently using softwares like this right now. So if you are having audio issues, we are hearing that if you call in, you are able to hear a little better. Right now, though, I am going to ask Joni from our BBB to chime in with any questions that she saw in our questions box that Mark possibly hasn't covered yet.
Good question, and that's specifically addressed in the updated information from the Labor Department. And what they've said is that intermittent leave is not available under the first 2 weeks where it's emergency paid sick leave if it's for the worker's health or a family member's health that they're caring for. And the rationale behind that is that leave and the 2-week time selected is the amount of time recommended by the CDC going back several weeks now. It seems like several years. But the self-monitoring time, when if someone has had exposure to COVID-19 and they have become infected, the 2-week time is considered to be a suitable monitoring period to assess whether in fact the person has contracted the disease, the virus or not. And so the intent is for the worker to remain away for a solid block of time to avoid posing a hazard to others in the workplace. Leave taken for childcare responsibilities can be used intermittently if the employer agrees to that, which is consistent with some of the traditional interpretations of the traditional FMLA for those companies with 50 or more employees may have encountered. An example of that is ordinarily intermittent leave is available when a worker can't come to work because of a serious health condition, traditional FMLA. When a worker who's had a baby wants to return to work intermittently, or a new father of a child wants to come back to work intermittently, that's permissible with the employer's permission, if the employer agrees to that. So similarly, under the application of this law with COVID-19, for the child care responsibility portion of the leave, intermittent is permissible as long as the employer agrees to it.
Thank you. Okay, next question. Does the shared work program have a minimum time period that the employer has to participate, say 3 months or 6 months, or is it flexible?
It's that once the approval is for a 6-month period of time, and as I said earlier, employers can readily get an extension of the 6 months if they need to continue with that. The amount of reduction in hours that an employer applies to the schedule for those employees selected can be anywhere from it's 10% It has to be at least 10%, and it can be as much as 60%. So it's a very flexible span that allows for scheduling variations, and an employer doesn't have to be consistent with all of the block of workers selected that week. I believe they have to apply shared work or reduced hours to at least 2 workers, ranging from the 10% reduction in hours up to as much as 60%, and can do so with different amounts with different workers, 1 week to the next, changing it out, selecting different workers from week to week as they choose, and not participating 1 week if they have enough work, so they want everybody on board that week.
Thank you. What if an employee elects to take a leave and we're still open for business? Would we have to pay out vacation pay? We have plenty of work for them.
I believe if an employee just says, hey, I want to go fishing for a week, all this stress and everything, a little quiet time with nature would be real nice. An employer could treat that the same as they have forever in terms of a request for vacation time, and say, sorry, no thanks. We're struggling to get by here, and we need all hands on deck. Can't allow that. And if the employee says, well, too bad, I'm leaving, that's a situation where the employer should issue an unemployment notice to that person indicating voluntary quit, and document that with the employee as well to say, in response to your request to take some vacation time, unfortunately, we can't allow that right now. You have chosen to disappear of your own choice, and we consider that to be your voluntarily declining suitable work. You're not here. We will not approve a claim for unemployment benefits. We'll challenge it, and eventually, and if the employee applies for unemployment and lies, issuing that UC-61 will be very helpful to document the circumstances surrounding that. And if the employee does slip through the system and get benefits, the unemployment system will eventually circle back and address those types of situations and deem it to be an overpayment and charge that person back.
Thank you. Can you furlough an employee who's in the work share program?
Yes, you can. If, for example, an employer submitted, all of their employees for participation in the shared work program, that doesn't insulate. Well, the employer can selectively schedule shared work hours for any of those for whom it appears to be appropriate based on the employer's needs. At the same time, an employer can reach into that same population and lay off any one of those folks, put them out for 1 or 2 weeks as a furlough week, and that individual would then get their regular unemployment benefits for total unemployment, as well as the $600 supplement that will be available through the end of July.
I did have 2 questions about the $600. Let me find them. Is that a one
point I'll make is, if it's not asked, whereas the regular unemployment benefits paid to workers on total unemployment, shared work unemployment, or partial unemployment is charged back to employers' unemployment tax experience accounts, and will cause their unemployment taxes to rise sometime next year in 2021 or thereafter. The $600 payment is being funded by the federal government and will not be a chargeable claim against the employer's account.
Will the $600 be paid in full even if the person's on shared work?
Yes, it will. That's
Okay.
That's something that was confirmed in a Labor Department notice that was sent around. Again, any of these documents I'm referring to, we've tried to post many of them on CDI's website, but if you send me an email, I can shoot them out to you as well. But the $600 is a supplement to anyone receiving unemployment benefits, whether it's total unemployment, partial unemployment, or shared work. unemployment benefits.
And is that $600 every week or a one-time deal?
Every week.
Okay.
I don't want to say there's a bright spot in this situation, but there are some folks who obviously we're all struggling with other aspects of this, whether it's stress or actual financial implications. But in terms of weekly compensation, there are some people who, with that 600, are probably going to end up with more money than if they had been working.
Is the shared work program accepting new applications? If so, is it retroactive? Someone was on a webinar yesterday and they were not sure if they were accepting new applications because they've gotten so many.
Now they're continuing to accept applications. I see no reason for them to shut that off. It's not as though there's a pool of money allocated to them, because ultimately much of that money is going to be paid back to the state through higher unemployment taxes for some time to come. It is only retroactive in the sense that today is Wednesday. If I had a company and I wanted to schedule shared work hours for my employees, and I submitted that application before the end of this work week, I could begin scheduling reduced hours as shared work hours beginning next calendar week, retain that information. I probably will not hear back from the Labor Department approving my application for several weeks, but the information I received earlier today was that unemployment will be accepting shared work benefit schedules as of the week the week after the company submits the application and indicates on the application form that they want shared work to apply to that company as of that particular date. So it will be retroactive in that sense. But if I submit for shared work participation this week, but I've had people on reduced hours for the last several weeks, I could not reach back to those prior weeks and submit workers to receive shared work benefits for those weeks.
Got it. If an employee's spouse is working from home and they have a small child that cannot attend daycare, if the employee wants to use the FMLA stating that he needs to take care of the child while his wife works from home, would he qualify?
Another interesting nuance that is addressed in the Labor Department questions and answers. Initially, that was not clear. They did clarify that the intent is to provide the emergency paid FMLA leave for childcare responsibilities only to the person who is primarily responsible for caring for that child. So as is indicated in the Labor Department's Q&A and in information we posted on the CBI.com website, within the items of information an employer should capture in order to evaluate whether someone's eligible for the emergency paid sick leave or emergency paid extended family leave, they should seek a statement from the employee that they are primarily responsible for caring for their minor child. Now, is that verifiable? No. Are employees likely to misrepresent what's going on with that? Very possibly. And are they going to get caught? I have absolutely no idea. But for employers' security, they should ask for a statement from the individual as to who is primarily responsible in the family for caring for that child. They should ask for the child's age and document that to back up the employee's assertion that they're primarily responsible. Some spouses, someone I spoke to yesterday, the wife is home working full-time remotely. The husband is home, is unable to work remotely, and therefore there are two parents in the household to watch the minor child, but the wife is working full-time. The husband does have time available, so that would be a legitimate circumstance where the husband would say, my wife is totally immersed in work, unable to provide the care for the child. I am the primary caretaker in that case. One other interesting note, it's not reflected in the IRS document, the IRS questions and answers, but it is in the Labor Department. If the child is under 14 and under, it's assumed that the parent is needed to care for that child. If the child is 15 to 17, it suggests that the employer should have a statement indicating the special circumstances that necessitate the employee's attention to care for that child. An assumption that maybe a 15, 16, or 17-year-old should be able to stay home, care for themselves. I'm not sure if that's going to be a consistent requirement, but there is a reference in the Labor Department questions and answers suggesting that they should seek some statement from the worker that because my older child is still under 18 but over 14 and is need of supervision or monitoring because of fill in the blank. I'm not quite sure what should be there. Special needs child obviously might be the case, or a child has a tendency to get into trouble, and therefore if I'm not home, all hell will break loose. That, in my mind, would probably suffice to meet the Labor Department's requirements.
Thank you. Here's another question. I have an employee who is on a reduced hours schedule, but he's a senior and collects some Social Security, so he's not eligible for unemployment. Does he have any other options available to him?
Well, good news that someone who's old enough to be receiving Social Security retirement benefits and still work and get a paycheck, if they lose their job, the Social Security benefits do not impact their unemployment benefit rate. If they're receiving a company pension or a company-funded retirement plan of some sort, there may be a partial offset to their unemployment benefit rate that reflects the amount of the company's contribution towards that pension plan. But merely getting Social Security retirement benefits does not interfere with their unemployment benefit amount.
Thank you.
Speaking of age, all public health officials have clearly indicated those 65 and older should remain at home. And in some cases, companies have approached those individuals and said, get out of here. I don't think it's safe for you to be here. And sometimes those individuals have accepted that and gone home. I would advise they confer with their doctor, who would very likely offer them guidance that they should remain away from work, and that would suffice at least for the 2 weeks of emergency paid sick leave and thereafter for receiving unemployment benefits.
Thank you. For extended family and medical leave, how do you treat seasonal employees? Is the benefit calculation based on hours scheduled on a go-forward basis? Under the sick leave provision, there's a 6-month look-back period. Yeah,
there are explanatory there's some explanatory comments in the Labor Department Q&As that review how to calculate for part-time workers the amount of pay, as well as for seasonal workers, which I believe does involve it suggests going back, I think, 2 weeks or a month, and if that's insufficient or inappropriate because of the variation in their schedule, to go back a 6-month period. So I think it would be a 6-month look-back period.
Thank you.
Now, one other interesting provision is if someone is not scheduled to work, they're not eligible for those benefits. So those benefits are paid only if there would otherwise be work available to them if they weren't faced with that restriction on their working as a result of their health or a family member's health or a child care responsibilities. So if someone is out collecting that leave and then they're furloughed or laid off, they would then interrupt their eligibility for the paid leave under the Families First Coronavirus Response Act, and instead be eligible for unemployment benefits.
Okay, I have one more question. Obviously, there are more questions, but we're running out of time. This one is, if an individual is out and qualifies for FFCRA paid sick leave for a dependent, are we able to supplement their pay with available paid time off, whether it's vacation, personal, etc., if they ask us to, because they're only receiving 2/3 pay?
Yeah, that also is addressed in the Labor Department documents. And if a person is receiving only 2/3 pay because they're home because of needs care for a family member or care for a child, they can supplement that with accrued PTO time, and it doesn't diminish the amount they would get under that paid leave provision. However, I believe the only amount they can recover from the payroll tax credit under the IRS provisions is the amount they're required to pay under that law, whether it's the 100% or 2/3 pay. One question that has come up is whether an employer could supplement an individual's pay who's out on unemployment. And generally, any additional pay provided to someone on unemployment does have to be reported by that claimant, which would ordinarily 2/3 of the pay given to the person would be an offset or reduction in their unemployment benefit amount. Another provision that was part of the CARES Act with the $600 is, although the $600 supplement is only through the end of July, unemployment benefits normally when someone's eligible they're eligible for up to 26 weeks worth of benefits in the 12-month period following their initial claim. The CARES Act extended that 26 weeks by another 13. So individuals for the remainder after July, if they've exhausted unemployment, they may be eligible for another 13 weeks of unemployment benefits for a total of 39 weeks. Also, sole proprietors, independent contractors will also be eligible for unemployment benefits. And the unemployment office does have a series of instructional pages on how to fill out the unemployment form in this unique environment we're in. One major question that I've been getting that we're not going to have time to go through in detail, but there is good information available on CBI website and CDC, is we have an individual who's advised us they've tested positive. What do we do now? And it's send that person home, tell them to remain away from home, inquire where they've spent time, who they've been in contact with in the workplace, so that some extra attention for disinfecting can be paid, as well as some inquiry to those with whom that person has had direct contact over the last few weeks to alert them of the need to confer with their healthcare provider. There's two different schools of thought on what to do with those individuals who've had exposure to the one symptomatic or diagnosed. CDC has and state health department through the governor's recommendations has recommended that person be sent home and told to monitor for 14 days. Other guidance I've seen suggests simply advising those individuals who've had close contact to more closely monitor their health over the next 2 weeks, and if they experience any symptoms, to immediately notify the employer. The wider population that didn't have that direct contact, defined as within 6 feet for a significant period of time, 10 minutes or more, should simply be advised that one of our associates at work, we believe you has been diagnosed or is exhibiting symptoms, and we urge everyone to continue carefully monitoring their health. And if you experience health issues, let us know, go home. Otherwise, continue with the very aggressive cleaning protocols we have in place, as well as the physical distancing and work scheduling practices and all of that. That increasingly has become a question that companies are posing, because increasingly they're being faced with reports of individuals experiencing symptoms or being diagnosed.
All right, Mark, that is actually all the time we have today. I appreciate you answering all of these questions. I get how it can be easily confusing for anybody who owns a small business to be able to know all of the ins and outs, and we are glad that you were here to help us all try to understand all of these new and changing opportunities that employers have. So I appreciate it. Thank you very much.
And what I'll say is that I can't promise how quickly I can get back to people, but if people have further questions, and especially if you're a member of CBIA, I urge you to join. But my email is mark.soycher, S-O-Y-C-H-E-R, @cbia.com. And we're doing our best to get information out there for people. And we urge everyone to be careful and respectful. And we'll get through this. Some of the loan programs that were addressed in last week's program have been helpful. They're struggling to get rolling smoothly, but I think there are some good safety nets being built in place. And hopefully we'll all get through this and eventually get back to work and have a wonderful day in the office. Thank you for the
I agree. I think
yeah.
everybody's all right, you too. And then anybody else who's calling in, if you would like to learn more about previous webinars or actually sign up for upcoming webinars hosted by BBB, that shortened URL is bit.ly/BBB COVID-19 webinar series. Thank you again. We appreciate everybody calling in and hope that we were able to answer as many questions as possible. And again, you can go to that shortened site, bit.ly/BBB COVID-19 webinar series. And it will have all of today's info, recording, and hopefully a couple helpful links as well. I hope you all enjoyed, and we look forward to having you on our next webinar. Thank you.